Good afternoon. I'm David Sweat, Deputy Director, Shelby County Health Department, and welcome to the City of Memphis Shelby County Joint COVID Task Force press briefing for April the 8th. Joined today by both Dr. Randolph, our local health officer, and Doug McGowen, Chief from the City of Memphis. Let's go ahead and jump into the numbers. We've had 92,058 cases of COVID-19 disease reported so far in Shelby County. That represents an increase of 152 new cases yesterday. We've had 4,833 cases reported from Fayette County in Tennessee, 7,158 cases from Tipton County in Tennessee. We've had 20,701 cases reported from DeSoto County in Mississippi, and 5,538 cases reported from Crittenden County in Arkansas. When we look at some of the other numbers, so far in Shelby County, 1,575 deaths have occurred because of COVID-19 disease during this pandemic. And on the vaccine front, we have vaccinated more than 254,000 people, and we've had more than 140,000 people now who have been fully vaccinated with 2 doses of a 2-dose series or a single dose of Johnson & Johnson vaccine. In fact, we've administered now more than 400,000 doses of vaccine in Shelby County. But this is a wonderful opportunity for our community, and one of the themes that you're going to hear all day today from us is that our community is poised to do something that no other community in Tennessee has been able to do. We are already outpacing the state in terms of the percentage of our population coming out to get vaccine, but we have an opportunity, if Shelby County residents will respond to that opportunity and grab it, to have over half of our community vaccinated before June. We have the vaccine, we have the appointments, it's available, it's free. All we have to do is take advantage of this wonderful opportunity. And for an update on the vaccine campaign, I'm turning over now to Chief Doug McGowan.
Thank you, David. I appreciate that. So David said we've had more than 400,000 vaccinations administered here in Memphis and Shelby County. More than 250,000, probably approaching 260,000 people have taken advantage of that opportunity. We really want that number to go up. Yesterday, we did have several thousand appointments go unfilled. Today, we still have more than 1,000 appointments available for individuals to take advantage of. And the balance of the week and over the weekend, and recall we're now 7-day-a-week operations at the Pipkin building, 12 hours a day. There are still thousands of appointments available for both first and second dose vaccinations at the Pipkin site. Many of our other sites have filled up, and we're very thankful for that. Our community partner sites are largely filled, and we're thankful for that. There is one location that over the weekend, from tomorrow and Saturday, down at the Whitehaven location, we are administering the Johnson & Johnson vaccine, and we have relatively low uptake in that area of those J&J vaccines. So recall that is a one-and-done vaccine, and that's an opportunity for people who would like to have J&J. I encourage you to sign up today on the Sign Up Genius, covid19.memphistn.gov, and roll on down to Whitehaven, take a look at Graceland, say hello to Elvis, and get a shot of J&J vaccine, and you will be fully vaccinated. We are working to fill those vacant appointments. Yesterday, we had the entire team come together, the federal team from FEMA, the DOD partners, our state team from Tennessee Emergency Management and Tennessee Department of Health, our local experts on the ground, to do a brainstorming session about what we could do from a communication standpoint, from an activation of neighborhood groups standpoint and other kinds of groups, and then from a process standpoint to try to get more interest and engagement in vaccines. And so because and from that exercise yesterday, we are making several pivots. Again, you've heard me talk about that before. Originally, we were going to do 3 weeks of nothing but first dose at Pipkin and then 3 weeks of second dose. We immediately, because of lack of response for the first dose, we opened that up to second dose appointments as well. This morning that we announced that not only will we do first and second dose at the Pipkin building, but effective this afternoon from 5 p.m. to 8 p.m., we will reserve 500 doses for people who would like to come without an appointment. So it will be first come, first serve from 5 o'clock to 8 o'clock tonight for 500 people who would like to come without an appointment. Now, for individuals who have an appointment at the Pipkin building during that period of time, I want to assure you, you will be given priority and we will not have people without an appointment go before you. So show up on time, you will get the same level of service that you should expect. The 10-minute kind of wait time, we will separate you from the folks that don't have an appointment and speed you through the line. But for everybody who would like the convenience of not having to worry about scheduling an appointment, come on by between 5 and 8, and the first 500 will get a vaccine. We'll do that again on Friday, again on Saturday, and again on Sunday. The second change will take place next week. And what we have seen from the uptake of vaccine is that very early in the morning, from 8 to 8:30 and 8:30 to 9, as people are on their way to work or after dropping kids off from school, people are taking advantage of those appointments, and then they kind of winnow down in the mid-morning, and then they pick back up in the afternoon. So we will open the vaccine site at the Pipkin building only. All of the other sites will remain 9 a.m. to 6 p.m., but at the Pipkin building only next week, at the community vaccination site, the hours of operation will be from 7 a.m. to 7 p.m. We are trying to capture people on their way to work, so we'll open an extra hour early to try to give people the opportunity to go get their vaccine early in the morning. There are other proposed changes, but that's a lot at one time. So again, starting today from 5 to 8 p.m., we'll be open for first come, first serve for the first 500 folks through the door. That will happen all the way through the weekend. Then next week, we will go 7 a.m. to 7 p.m. at the Pipkin building only. All other appointments remain the same. One of the things that you all have asked is, how do people who don't otherwise have access arrive for a vaccine, especially folks who are mobility challenged? Starting on Monday, our partners at MATA, just like they did rides to testing, will be performing rides to vaccination. There is a new number. Anyone who is eligible for MATA Plus services needs only to call the 497-1598 number and say, I need a ride to get a vaccine. You do not need to schedule an appointment. As soon as you call the 497-1598, the MATA personnel will arrange a time that is convenient for you to transport you to the Pipkin building for a vaccination. You will be automatically scheduled for an appointment at that time with no effort on your part. You will be given the forms to fill out on the way to the vaccination site, so there's no waiting. You will be given special access into the fairgrounds, and you will be sped on your way as soon as you've waited your 15 minutes and returned to your home. So that begins on Monday. On this Sunday, from 8 a.m. to 4 p.m., you can begin calling that number to schedule your ride to vaccine. So again, I encourage people who are MATA Plus customers, and there are 5,000 to 6,000 MATA Plus customers in the area, please take advantage of this opportunity. 497-1598. Start calling this Sunday to set up your appointment, and we'll be happy to serve you at the Pipkin site and get you back to your home. For transit riders, there are several transit routes that serve the fairgrounds. If you bring to the transit site and you show to your transit driver your appointment, you will have a free fare. You will be given a voucher for your return trip to the fairgrounds, or to the fairgrounds for your second vaccination. So we don't want cost to be a barrier for folks to come and get their vaccine. So again, if you take the bus, please take the bus, navigate your way to the fairgrounds. We will have a clearly indicated bus stop immediately adjacent to Tiger Lane. You'll disembark the bus. You will walk in, get your vaccination. You can come back out, jump back on the bus, and get back to your destination. You will be given a voucher that will cover the cost of your fare for your return trip and also for that trip. If you are concerned I understand that Gary and his team at MATA do a really good job of trying to improve on-time performance, but there are times when the bus is late. If your bus is running late, I encourage you just to jump on the bus and come on down anyway. We will not cancel your appointment simply because you are late. Once you have an appointment, we have that slot reserved for you. We have a vaccine available for you. So jump on board, come on down, and even if you're a little late, we're not going to do away with your appointment. We want to serve you. It is important for our community to get vaccinated. It's important for our community to continue to get tested. I feel lucky to be among the people who have received the second vaccination. I do personally take advantage of the weekly testing that is available to us through asymptomatic testing. And so I go and personally partake of that testing just to make sure that I understand my status. I'm encouraging everybody to continue to do that. Vaccinations are our key to getting out of this pandemic. And so I'm going to introduce Dr. Bruce Randolph, who would like to talk a little bit more about the importance of vaccines and to share a message with everybody about why it's important for you to come and get a vaccine. Dr. Randolph.
Thank you, Chief McGowen, Mr. Sweat. Greetings, fellow citizens of Shelby County Health. I'm Dr. Bruce Randolph, the Health Officer for Shelby County Health Department. I'd like to just spend a few minutes talking about the importance of getting vaccinated. First, I want to just thank you, fellow citizens, for the support and cooperation that you have extended to this point. Our numbers, although today are up, overall have been downwardly trending, and we've made tremendous progress. I'm an old football player, and so I want to just use the football analogy. We're in the fourth quarter, slightly ahead, but the game is not over. The virus is still putting up a tremendous defense, but we can win this game. We can win it if we continue to play hard by doing the things that have gotten us to this point and then take it a little further with getting vaccinated. So I want to encourage and appeal to all of the fellow citizens and all who are around Shelby County, please get vaccinated. There are benefits from the vaccine. One is that you can spend more time with your family without having to wear a mask. If you're of the same household, they're in your household, particularly if everyone is fully vaccinated. You can visit your loved ones if you are fully vaccinated and they are vaccinated. You can visit them in long-term care facilities like nursing homes. I had the opportunity of embracing my mother, 88-year-old, after a year of not being able to do so. I was able to embrace her, and she embraced me. Why? Because she had been fully vaccinated, I've been fully vaccinated. There's no way that I could have done that had not we been vaccinated. That's the benefit of getting vaccinated. Also, I attended church in person with mask. I would not have done that had I not been vaccinated. And so there are benefits that I really want to emphasize that outweighs the risk of getting vaccinated. The other benefit is that if you happen to be around someone who is infected, you've been exposed, you're a close contact, you do not need to be quarantined if you are fully vaccinated and you do not have any symptoms. More importantly, the reason why you ought to get vaccinated is because it prevents serious illness and death. You know, some people have complained or worried about this vaccine and said, well, it was created too fast. Truth of the matter, it was not created too fast. The technology that's being used have been studied and researched almost 20 years. It just so happened that we had it now available that we could implement it quickly once we learned the genetic code of the virus. But the other thing is that, there's been some reported side effects, but those side effects have been very small and minor. Soreness in the arm, soreness in the muscle, soreness, some aches, some fatigue, and what have you. But to my knowledge, we have not had any associated deaths as a result of receiving the vaccine in Shelby County. But we have had over 1,500 deaths associated with COVID. We do know that if you get COVID, there's a risk of severe illness, hospitalization, and death, particularly if you have comorbidities. And we know a lot of us are obese, a lot of us have hypertension, diabetes, a lot of us, like me, got a BMI over the 30. We need to get vaccinated. We must do our part so that we can continue to make the progress. We got to continue getting tested if you having symptoms or been around someone. Keep separated. Wear your mask. Avoid crowded and poorly ventilated places. Wash our hands, clean, sanitize. But most of all, at this stage, the fourth quarter, we're almost at the end, we can punch this ball across the goal line and win the game if we get vaccinated. And so I'm asking everyone, young and old, teachers, leaders, healthcare providers, first responders, everyone, let's do our part and let's get vaccinated. With that, I will open it up for any questions that you may have.
Brad Broders, Local 24.
Good afternoon. First question's for Doug. I know you were talking about some other potential pivots. Are there any other ideas that you all are brainstorming, whether it's neighborhood canvassing or things of that nature? And I have a follow-up.
Sure, that's a great question, Brad, and that is one of the things that we talked about is how we get the message out via all of our public-facing services, both from Memphis and Shelby County. A lot of things talked about neighborhood, door knocking, hanging door tags, those kinds of things. So a lot of those good ideas, and we'll, as those develop, we will bring those forward. One idea that has gotten traction is the idea of group appointments. I mentioned that briefly yesterday, but the opportunity for a church group, for a business to call through either the COVID-19 help, to email through the COVID-19 help and or to call and schedule a block of appointments. We have 100 church members that would like to get vaccinated, and if they can make a plan to transport them or either via van or via their personal vehicle, we will block out an entire period of time and vaccinate everyone. An athletic team, some of the university groups, a fraternity, a sorority, a business. If you have 10 people, you have 100 people, you have 1,000 people, we'd be happy to accommodate your group and fit you into a slot that would be all yours, and we could get all of you done at the same time. So that's something that I think is already picking up traction and steam. We have several groups that have already expressed interest, and so I will say, if you are associated with a business, if you're associated with a group, an organization, and you would like to organize your folks to come at a specific period of time and so that you can all come together, we would love to host you at the Pipkin site. We have plenty of availability. The folks on site are eager to serve you. I think you'll be inspired when you go there to see the federal, state, local, Department of Defense, soldiers, sailors, airmen, Marines, National Guardsmen. They're willing to serve you. So we would love to have your group or organization. Please put your request into COVID-19 help at memphistn.gov, and we will be able to help you block that appointment.
Thanks, Doug. And as a follow-up, I know we talked about this last Thursday about at what point will supply outweigh demand. Are you all concerned that we're at that point yet, or there's still progress that can be made to meet the supply?
I think that there's still progress that can be made, Brad. I'm optimistic and I'm high on what we can do here in Memphis. It's the city where anything can be made to happen, and I know Memphians will rise to the challenge. So we're going to do everything we can to make it as easy as possible for folks to drive as much awareness as we can. I think there will be a time when supply outweighs demand. I don't believe that we are there yet, but we are willing to continue to work to make sure that we do everything possible to get as many people out to get vaccinated as we can.
Reseda Holgan, WMC.
Hi, yes, good afternoon to everyone. When you were talking about, first day of yesterday at Pipkin, if you can kind of reiterate how yesterday went and kind of explain what you guys are doing to avoid wasting vaccines and how you guys deal with the no-shows, and how much vaccine is pulled at the end of the day. Sure. To avoid those no-shows, yeah.
So I just want to be very clear. There's a very real difference between wasted opportunities for vaccinations, wasted appointments, and wasting vaccine. 0 vaccine doses were wasted yesterday. I'll say that again. No, 0 vaccines were wasted at the mass vaccination site yesterday. We had 800 appointments at the beginning of the day. We brought 1,750 doses of vaccine to the site. During the course of the day, we served 1,024 individuals. And at the end of the day, we had 7,026 vaccines remaining in the vial at the appropriate refrigerated temperature. All 726 of those doses were returned to the pharmacy and put into the refrigerator. They have 5 more days that they can be used, and they were the first vaccines put out this morning to a number of other sites. No vaccines were wasted. I know there was a report to the contrary. I never said that. No city official ever said that. That is patently false. To make sure that we don't waste any vaccines, we do several things. First, we look at the schedule. Then we source the site with just enough vaccines to cover the appointments that we have, any same-day appointments we get, and in the case of today, where we're opening this afternoon with 500 slots for people between 5 p.m. and 8 p.m., we also bring 500 doses to make sure that we can service those individuals. The only time a vaccine dose is wasted is if it is pulled into a syringe, and then it has a 5-hour expiration time. And once it's in the syringe, if we can't put it in someone's arm within 5 hours, that dose becomes wasted. To avoid doing that, our team on site keeps the vaccine refrigerated at the appropriate temperature. They look at the line of cars compared to the appointments, and they only draw sufficient vaccine to serve the number of cars that are actually in line, so that we know for sure that that vaccine, once it's into a syringe, goes into somebody's arm. I hope that answered the question.
It did, thank you.
Jane Roberts, Daily Memphian.
Sounds like the vaccine work is going real smoothly. I think the other issue that's part of the story right now is how the variants are growing. Has there been a recent update on that?
I'll ask David, who's our expert in the variants, to give us an update on that.
Thank you. Thank you, Jane, for the question. So, yes, we are continuing to monitor and investigate and follow all of the issues associated with the transition between the mix of viruses in our community moving from normal COVID wild type that we have been dealing with for the past year over into a new period, a new phase, where the predominant strain circulating in the community is this B117 strain from the United Kingdom. Yesterday in the lab directors meeting, we met and continued to talk about sequencing and the data from sequencing to try to monitor the transition. And out of an entire run coming out of one of our labs that was reported in the meeting yesterday, I mean, they came off the machines while we were meeting, there was only a single instance on that run of sequencing that showed the wild type virus. Everything else was basically predominantly the UK strain. And we have some other variants that are not of any public health importance, but we're documenting them, a strain out of California, a strain out of New York, various strains, but they don't have the mutations that make them dangerous. But what we do see is our entire community, all the communities in Shelby County are experiencing a transition over to where the UK strain is the dominant virus. And we have had a handful of cases with the P1 strain that's out of Brazil that's been introduced into our community. It's actually been introduced independently at least three to five times. And the good news there so far is that cases have been isolated, contacts have been quarantined. When we've done circle testing around those individuals who have sequenced out with that virus, we have not found additional positives. So that is good news. And that proves that the mix of tools we have to control the spread of the virus is being effective for now. Our reproductive rate of the virus has dropped to 1.03, and so it had been up to 1.07. We're still, every case is creating one or slightly more than one additional case. The good news is this UK strain is, the vaccine works against it. It protects you from it. So even though we're seeing this variant strain take over in the community as the dominant virus being transmitted, the vaccine will protect you from it. So we also see that this variant strain, the UK strain, is transmitting even more so among our people of younger age groups, people in their 20s, people in their 30s, people in their 40s. That's where 70% of all the variant strains we've detected have been detected in people in those age groups. So as has been the message throughout this press briefing, we want everyone in Shelby County who is eligible to receive these vaccines to please come forward and avail yourself of this opportunity. It's completely free. There's no charge to you whatsoever. The only cost to you is your time to come forward and accept the vaccination that's being offered to you. And we have offered it all over the county through many different sites and locations where you can make an appointment, or you can just come up to the Pipkin building this evening or any evening this week from 5 to 8 p.m. If you have no appointment, just show up and we will vaccinate you. If you are 16 years of age and older, you are eligible to receive the vaccine, and we encourage all of you to come out and do so.
Jane, was there a follow-up? Sam Hardiman, Commercial Appeal.
Hear me?
Yes, we can hear you now.
Dr. Sweat, it's a question for you. When you say that the P1 has been introduced separately 3 or 4 times, at this point, how many contacts of those P1 cases have been placed in quarantine? Then I have a follow-up.
Yeah, I don't have the exact number off the top of my head. I mean, Sam, if you want to communicate through Chip and we can get some precise numbers around that, it's a small number around each person. Probably what we're looking at in terms of the different introductions is a couple of different travel associated instances, once going to Mexico, once going to Brazil, coming back with the virus. Small number of contacts around each of those persons. We've got another couple of clusters that are connected socially. But in these instances, what we've been able to do is isolate the cases, and usually the contacts are household contacts and coworker contacts. All of those people have been reached with messaging that they, basically if you've been exposed and you've been named, you've been informed of the importance of both testing and quarantining. The good news is that all the people who have been tested around these cases have come back with negative tests. And so that's really important. We're not seeing the virus proliferate. We're not seeing in their circle of contacts at work and in their household the greater spread so far. So we're grateful for that.
And my follow-up is, Sarah, I appreciate that answer, is when you say that a whole stretch of sequencing came off the rolls yesterday during a meeting, and all of it, only one was wild type, I understand that it's just one batch of sequencing, but does that make the UK variant the dominant strain? Is the health department comfortable saying the UK variant is now the dominant strain in Shelby County?
I think it's very likely it is. We had already predicted that it would be the dominant strain before April 15th. Today is April 8th. And all of the sequence runs that are coming out of UT Health Science Center, coming out of Popular Healthcare, coming from the other sequencing labs, they're all showing the same trend that over half of what gets sequenced is coming out as that UK strain. So, only probably 20 to 25%, 20 to 30% of the cases in the community get diagnosed. So we are relying on the samples to reflect to us what's going on in the community. But all the indications are that the UK strain is, or is very shortly going to be, the dominant strain in our community.
We are out of time. Are there any closing messages today?
We just want to reiterate, we are all grateful to the 260,000 Shelby County residents who have come forward and presented themselves and availed themselves of the opportunity of the vaccine. And for those of you who are only partway through your shot series, we obviously encourage you to keep the course and come out for your return appointment and get your second dose. But now the opportunity has just been laid out there on a silver platter for everybody in the community who's eligible to come on and get it. We got plenty of it. We're happy to give it to you. So please come on out and we will serve you to the best of our abilities. Thank you.
Thanks, everyone. We'll see you back here next week.